Looking to the future, I want to set out some challenges for HEIs that I think also have that potential to be opportunities. First, COVID-19 made it really clear that an effective response required us to think and work holistically across the whole institution and as part of the wider whole system of the communities in which our universities are located. I think a challenge that we can usefully translate into an opportunity when advocating the healthy campus approach. COVID also highlighted that people and their health are essentially holistic, something that should come as no surprise given the shared roots of the word whole and health in both English and Gaelic. As a communicable disease caused by a virus, COVID affects physical health, but the disease and responses to it has significantly impacted mental well-being. These effects are in turn mediated by social well-being, the impacts of containment measures strongly influencing patterns of interaction and connectivity. And the pandemic also prompted many to explore more deeply what can be termed spiritual health and to connect with the environment around us. Its likely zoonotic origins have further heightened awareness of the interdependence between the health of people and the environment, and of the importance of respecting and working in harmony with the earth, with lockdowns offering glimpses of what a new and different world might look like and what it might mean to build back better. Second, this shift towards a holistic and systemic model of working makes it enormously challenging to build evidence of effectiveness. It's much easier to evaluate a discrete health promotion intervention than to capture the added value of a whole system healthy campus programme, comprising as it does multiple interconnected activities and components in the context of long-term organisation development and culture change. However, there is an emerging evidence space, and we have seen a commitment to whole institution and whole system thinking gradually permeate the strategies and plans of the higher education and health sectors. Furthermore, I think universities and colleges are well placed to seize the opportunities to develop collaborative evaluative research and to engage with real-world complexity, drawing on approaches such as realist evaluation and theories of change, to build a robust and persuasive evidence base. As I've said, I think it's great that Trinity College Dublin partners have been awarded the Evaluation Toolkit tender, and I'm really excited to see that finalised and rolled out across the network, because I also think that that could lead on to further research opportunities across institutions. Third, even if we understand the importance of holism, we may still struggle with the real-world challenges involved in taking a concept as complex as healthy campuses and translating rhetoric into effective action. However, I'd urge you to hold on to that big vision, even if it might seem that you're only taking small incremental steps on the journey. For some institutions, that might mean focusing on a few thematic areas at first. For others, it might mean starting off working with one or more departments or services. I think if we're to move beyond delivering fragmented health promotion interventions to instead implement and reap the opportunities offered by a truly whole campus approach, then we need to break down silos and work systemically. Fourth, it's really challenging to combine leadership that balances an inward focus on the health of students and staff with an outward focus on the university's wider role in generating societal well-being. Returning to the quote from the President of Ireland that I alluded to, it's clear that universities are both apart from and a part of society, and they play a crucial role in reimagining the world as it ought to be, but they have a very crucial civic responsibility to engage with society and apply learning. This echoes the renewed focus in the UK on the idea of the civic university, with the institutions taking opportunities to strengthen engagement with communities and communicate a compelling narrative about their societal value within the context of place. It also echoes calls for a focus on global citizenship, recognising that HEIs function within the context of converging and intensifying challenges such as climate change, resource depletion, and social, economic and ecological injustice. I think as a sector, higher education has a potentially powerful leadership role, not only through promoting the health of its community in the present moment, but also by practicing meaningful corporate responsibility and advocating for transformative change that will promote well-being societies. Importantly too, as I mentioned earlier, I think we need to take a long-term view that looks beyond as well as outside the institution, and I think we can lead in that way too, where we're actually about harnessing that leadership potential of our students, developing them and indeed staff as active citizens and future leaders, decision makers and influencers, able to advocate and mediate for human and planetary health. Fifth, it's been challenging to respond effectively to the problems that permeate our university communities, whilst retaining a salutogenic focus that moves beyond prevention and aspires to promote and enable well-being and thriving. I'll just use two examples to illustrate this. First, in the UK we've experienced rapidly increased concern about mental ill health among students, with almost daily media stories about a mental health crisis. I think while this has put health high up on the agenda of decision makers in higher education, responses have not surprisingly tended to focus on early intervention, crisis management, and enhanced provision of counselling and other services. Consequently, many institutions have struggled to find the space or resource to focus on prevention and the wider promotion of holistic health and well-being that inevitably require us to invest in healthy campuses, looking upstream, harnessing contributions that may not be explicitly labelled health, and seeking to address the connections between physical, mental, spiritual and social domains. Second, the climate emergency has importantly directed attention on carbon reduction and the pursuit of net zero, a focus that reflects the traditional environmental management approach taken by universities and many other sectors, with a concern to reduce the negatives. By bringing together the common perspectives that flow from a commitment to salutogenesis and I think what can be termed regenerative or restorative sustainability, I think we can raise our aspirations so that our strategic plans, campus design, operational management, research focus and curricular orientation simultaneously promote the positive well-being and thriving of both people and the earth that sustains us. This leads on to a sixth challenge which brings us full circle to revisit the concept of holism, with a concern to strengthen the connections between healthy campuses and other agendas such as sustainable development, diversity and inclusion, and social and environmental justice. And this means joining up to move from multiple, often disconnected programmes to a more cohesive approach, identifying thematic areas that span silos in an integrated way. For example, developing a green, active and affordable travel plan and putting in place a healthy, safe and sustainable food procurement policy. It will also mean reflecting on the dialogue taking place in wider society, such as WHO's call for an equitable economy that serves human development within planetary boundaries. And the final challenge is for us to activate and energise ourselves and colleagues so that we and they move beyond seeing the pursuit of healthy campuses as someone else's responsibility and seize the moment to use our multiple roles to translate those challenges into opportunities. And that's not to say that each of us carry the weight of what needs to be done on our own. We'll need to continually engage others at multiple levels across our campuses and work together to lead and implement whole institution change.